There are many causes of ovine abortion, so it's important to engage with your vet to try and identify the actual issues and the causes of abortion if it occurs in your flock. Two of the most common causes of abortion in sheep are toxoplasmosis and Chlamydophila abortus. Chlamydophila abortus is also known as enzootic abortion of ewes. If you have a clean flock and don't have an issue with enzootic abortion, the only way that this can be introduced into your flock is by purchasing in a latently infected ewe. This is a female that has been exposed to chlamydia or Chlamydophila abortus in the lambing pen in the previous year, and she then becomes latently infected. Next year, when she's pregnant, around about 90 days of gestation, the infection causes an inflammation in the placenta. This then results in the ewe having an abortion and expulsion then of the fetus and the placenta. The fluids that are expelled, unfortunately, they are extremely infectious, and other ewes in the pen then can become infected due to exposure of the fluids as well as the fetus and the placenta. So it's important, therefore, if a ewe does abort, remove her from the lambing pen, isolate her, remove the materials that are present as well to avoid any further spread to any other females. Unfortunately, due to latency, this can ultimately end up in ewes aborting in subsequent years, so it can be quite a frustrating disease to get a hold of. Control approaches then for enzootic abortion can be quite difficult due to latency. Vaccination plays a key role in controlling enzootic abortion in your flock. The enzootic abortion vaccine should be given to the whole flock in the first year and then the replacements thereafter for each year. The vaccine should be administered to ewe lambs from 5 months old. This vaccine should be administered to all breeding females at least 4 weeks prior to tupping. The vaccine is a live vaccine, so a single dose is administered. It's a 2 ml dose and it's given either into the muscle or under the skin. This vaccine can also be given along with a vaccine for toxoplasmosis. Enzootic abortion of ewes is a sheep-to-sheep transfer of disease, and this is quite different from toxoplasmosis. Toxoplasmosis is a rodent to cat to sheep transfer disease. Toxoplasmosis is spread when a cat eats a rodent, so they hunt and they eat rodents. The parasite then completes its life cycle in the gastrointestinal tract of the cat, and the cat sheds out those oocysts then in its faeces. Those oocysts can be shed for up to 14 days in cats, but remain infective and live in the environment for years. Ewes then can become infected with toxoplasmosis oocysts when they ingest contaminated food or water supplies. Depending on the time of infection, really does dictate the clinical outcome. So if a ewe is infected and she's not pregnant, really we don't see any clinical signs. She develops a natural immunity. However, this natural immunity is unreliable as we don't know exactly how long that will persist in her system. If she's infected during the early stages of pregnancy, early embryonic loss can occur, fetal resorption, mummification, and also abortions. During mid to late pregnancy, we can also see abortions, stillbirths, the birth of weak-born lambs. It's important for any lambs that are aborted to take these to the lab and get a diagnosis. Normal biosecurity measures don't really work when we're thinking about trying to control cats and the cat population on farms. Therefore, it's important to keep feed supplies covered and try and avoid cats from gaining access to those. But really, vaccination is a very practical approach to controlling toxoplasmosis in your flock. The vaccine for toxoplasmosis is a live vaccine. It's administered to all the breeding females in the flock in the first year, and then the replacements thereafter. It's a 2 ml dose given into the muscle. This vaccine should be given at least 3 weeks prior to tupping. If you're using this vaccine along with the enzootic abortion vaccine, the two vaccines can be given together on the same day and administered at least 4 weeks prior to tupping. Kieran, if you're called by a farmer to a flock where there's been an issue with abortions, what's your advice then around abortion diagnostics?
Okay, so any abortion should be investigated. And the most important thing is get the aborted fetus and the afterbirth or cleaning to the regional veterinary lab as soon as possible. So it's very important that whenever this happens, that these samples are taken freshly and taken in. Again, if you're a long way from a regional veterinary lab and it's not possible to get those samples taken in, speak to your vet. Your vet will be able to take swabs from the fetus and also from some samples from the afterbirth and get those samples into the lab. It's really important that you get an accurate diagnosis of the cause of the abortion, and then knowing that, you can hopefully prevent that through vaccination in the future.
Tell me a little bit, Richard, about your approach to tackling abortion and fertility on the farm.
Yeah, well, I suppose we'd have a good eye on abortion over the years. We had problems with Campylobacter. We had a storm of that. That's a number of years ago now, but we would always been keeping an eye on toxoplasmosis, and we've been vaccinating for that for a good few years, and it's working well, keeping our numbers down to very small amounts.
You also vaccinate for Enzootic abortion, isn't that right?
Yeah, on veterinary advice, we started vaccinating a few years ago. A couple of guys in a discussion group I'm involved with had a problem with Enzootic abortion, and we made a decision to start vaccinating, and we started by doing the OLAMs, and every year the OLAMs that we include are vaccinated for Enzootic and toxoplasmosis.
Sounds like you've got a really good, robust strategy there to reducing and minimising losses due to infertility and abortion, Richard.
Yeah, absolutely.